I'm Representative Susan Johnson from Connecticut, and I'm incredibly honored to receive this wonderful nomination for the work that I've done to help people with mental health issues at the state legislature. Let me just give a little bit of background about what I used to do. I worked at Legal Services, representing people in Medicare and Medicaid cases, and it really gave me a lot of familiarity with a lot of the issues that people face today. And I also, as a lawyer, have been working back in the day representing people in Social Security disability cases. Many of the cases that I worked on had behavioral health issues. And so that's part of the reason I've been able to work here at the Capitol and help people with mental health issues legislatively. And so this is a wonderful honor, and I've been really glad to be able to do this work. As the former chair of the Public Health Committee, I had the honor to be the Public Health Committee chairman during the horrible tragedy of Sandy Hook. And this really cued me into some of the deficiencies that our state and our country have with respect to how we deal with mental health issues. We found that we had very few psychiatrists and psychologists to work with our students in schools. We found that a way to address that was to coordinate pediatricians with psychiatrists and psychologists, and we passed laws to also address mental health first aid in schools so that teachers would be able to identify students who suffered with post-traumatic stress disorder and had other types of behavioral health disorders. So as a person who has been working in that area, I was very pleased to be able to make a lot of changes there. As I moved on and went on to work as the chairman of Regulations Review, I also worked very hard to try and address some of the problems that I found with respect to workers' compensation. One of the things that I found is there was delays in providing treatment to people who are on workers' compensation who have been injured. Those delays resulted in people becoming addicted to drugs. And because they didn't get the correct treatment, they were able to not follow through with their jobs, and they were finding themselves at a real loss. And so we've been working on making sure that people who are in situations where they're injured actually are getting the kind of treatment that they should have so that they don't become addicted. And this is also demonstrated most recently by our Attorney General, William Tong, who was able to create a settlement with the pharmaceutical industry. The pharmaceutical industry had been benefiting from the sale of narcotics to people who were injured, and the insurance industry had been benefiting from not treating people the way that they should be treated with respect to getting the physical therapy or the surgery that they need. So this is something that, we've been working on, and we have seen some progress. Moving along to the last couple of years, House Bill 5001 in 2022 and House Bill 5001 in 2023 also address the behavioral health issues that many children have, and it expands resources for children in our state to be able to access more mental health services. So I would recommend and provide copies of some of the summaries of those two pieces of legislation for the last 2 years. And for those reasons, I am very honored to be able to continue to work in this area. I want to again thank Connecticut Mental Health for the nomination, and I look forward to working with everybody on the state level and the national level to continue the work that we've been doing to make sure that our students and our people get the kind of services that they should be getting to make our society much healthier. Thank you so much.